A heart attack isn't just another health scare. It's one of the most sudden and fatal conditions one can experience. It strikes fast, often without warning, and in many cases, there's no second chance. That's why anything that significantly raises your risk of a heart attack should be taken seriously and avoided whenever possible. We all know that things like smoking, high cholesterol, and stress can put a massive strain on the heart. But what if I told you that certain widely used medications, some of which you may even have in your home right now, could drastically increase your chances of a heart attack? The shocking part? Most people taking these medications have no idea of the risks they pose. Today, we're revealing 7 medications that have been shown to massively increase the risk of heart attacks. The last one on this list is especially dangerous, significantly increasing the risk of heart failure, and it's something millions of people rely on every day. Now, to be clear, we're not anti-medication. We understand that some people need these drugs to manage serious conditions. That's why we're not just exposing the risks, we're also giving you research-backed strategies to reduce your chances of a heart attack if you have to take these medications, and we'll even share safer alternatives where possible. Before we dive in, please hit that like button and subscribe to the channel to help more people who will benefit discover this video. Let's get started. 1. Calcium channel blockers. Isn't it ironic that a medication prescribed to reduce the risk of heart disease complications is actually linked to a higher risk of heart attack? Calcium channel blockers, CCBs, commonly used to treat high blood pressure, angina, and certain arrhythmias, may seem like lifesavers. But research suggests that long-term use of these drugs could be putting your heart in danger. Calcium channel blockers work by relaxing blood vessels and reducing the force of the heart's contractions, which helps lower blood pressure. However, this very mechanism can backfire in some cases. A major study published in the Journal of the American Medical Association, JAMA, found that short-acting calcium channel blockers, such as nifedipine, were associated with a 60% higher risk of heart attack compared to other blood pressure medications. The rapid drop in blood pressure caused by these drugs can lead to reflex tachycardia, a sudden increase in heart rate. This places extra strain on the heart and increases its oxygen demand. If the heart does not receive enough oxygen, a heart attack can occur. The risks don't stop there. While long-acting calcium channel blockers, such as amlodipine, are considered safer, studies still suggest that prolonged use can weaken the heart over time. If someone must take a calcium channel blocker, there are ways to reduce the risks. Extended-release formulations are generally safer because they cause a more gradual drop in blood pressure, reducing the risk of reflex tachycardia. Regular heart monitoring, including echocardiograms and electrocardiograms, ECGs, can help detect early signs of heart failure. Combining calcium channel blockers with a heart-healthy lifestyle, including regular exercise and a low-sodium, potassium-rich diet, can enhance their benefits while reducing reliance on them. Certain foods, such as grapefruit, should be avoided, as they can increase drug levels in the bloodstream and raise the risk of side effects. A promising alternative to calcium channel blockers is magnesium, a natural mineral that works as a powerful vasodilator, relaxing blood vessels without the dangerous side effects of prescription CCBs. Magnesium acts as a natural calcium channel blocker by preventing excess calcium from entering heart cells. This helps reduce arterial stiffness, lower blood pressure, and protect against arrhythmias, all without causing the sudden spikes and drops seen with calcium channel blockers. While magnesium is generally safe, it is important to note that people with kidney disease need to be cautious. Since weak kidneys may struggle to clear excess magnesium from the body, this can lead to toxicity. Before adding magnesium supplements to your routine, it is essential to consult a healthcare provider, especially if you are already taking medication. 2. Rosiglitazone, Avandia. Rosiglitazone, sold under the brand name Avandia, is a medication prescribed to help lower blood sugar levels in people with type 2 diabetes. At first glance, it seems like a beneficial drug, helping millions of people manage their diabetes and reduce complications. However, shocking research has linked rosiglitazone to a drastically increased risk of heart attack and heart failure, making it one of the most controversial diabetes medications in history. A groundbreaking 2007 study published in the New England Journal of Medicine revealed that patients taking rosiglitazone had a 43% increased risk of heart attack and a 64% higher risk of cardiovascular-related death compared to those who were not taking the drug. The main reason behind this risk is fluid retention and increased strain on the heart, which can gradually lead to heart failure. Rosiglitazone belongs to a class of drugs called thiazolidinediones, which work by making the body more sensitive to insulin. However, in the process, they cause the body to retain more fluid, leading to swelling, edema, increased blood pressure, and extra workload on the heart. For people who already have heart disease or are at risk of developing it, this can be a recipe for disaster. The risks associated with rosiglitazone were so alarming that in 2010, the FDA severely restricted its use, and many countries outright banned the drug. Although restrictions were later eased, its safety remains a major concern among health professionals. For those who are on rosiglitazone or similar medications, it is crucial to discuss alternative treatments with a healthcare provider. Additionally, natural approaches like improving insulin sensitivity through diet, exercise, intermittent fasting, and magnesium supplementation can be powerful tools in managing diabetes without the heart risks associated with rosiglitazone. If you or a loved one is taking rosiglitazone, it's important to be aware of the potential dangers. Always consult your doctor about safer alternatives and lifestyle changes that can help manage diabetes while protecting your heart. 3. Proton pump inhibitors, PPIs. I know acid reflux and other GERD-related issues aren't funny to deal with, but is it really worth the risk of increasing your chances of a heart attack? Millions of people take proton pump inhibitors, PPIs, like omeprazole, Prilosec, esomeprazole, Nexium, and pantoprazole, Protonix, every day to control acid reflux, ulcers, and heartburn. But shocking research suggests that long-term use of these drugs may drastically increase the risk of heart attack and heart failure. A massive study published in PLOS One analyzed data from over 2.9 million people and found that regular PPI users had a 16 to 21% higher risk of heart attack compared to those who didn't take them. Another study in the Journal of the American College of Cardiology discovered that PPIs may reduce the production of nitric oxide, a critical compound that helps relax blood vessels and improve circulation. Without enough nitric oxide, the arteries become stiff and constricted, leading to high blood pressure, poor circulation, and an increased risk of heart disease. And it doesn't stop there. PPIs have also been linked to chronic magnesium deficiency, which is a serious problem for heart health. Magnesium is essential for maintaining a healthy heart rhythm, relaxing blood vessels, and preventing dangerous blood clots. Long-term use of PPIs blocks magnesium absorption, which can lead to irregular heartbeats, arrhythmias, high blood pressure, and an even higher risk of heart attack. So, what can you do if you suffer from acid reflux but want to avoid these risks? The first step is to use PPIs only when absolutely necessary and for the shortest duration possible. Studies show that lifestyle changes and safer alternatives can be just as effective for many people. Simple strategies like avoiding trigger foods, spicy, fatty, and acidic foods, eating smaller meals, maintaining a healthy weight, and not lying down right after eating can significantly reduce acid reflux symptoms. Additionally, natural remedies like magnesium, ginger, and digestive enzymes can help soothe acid reflux without harming the heart. Magnesium, in particular, not only aids digestion but also relaxes the esophageal sphincter, reducing the backflow of stomach acid. However, it's important to consult a healthcare provider before adding magnesium, especially if you have kidney disease or are on other medications. 4. Clozapine and olanzapine. Both clozapine and olanzapine belong to a class of drugs called atypical antipsychotics, and while they can be effective for treating severe mental health disorders, they come with a hidden danger. They significantly impact heart health in multiple ways. Studies have shown that these medications can lead to rapid weight gain, high blood sugar, and increased cholesterol levels, all of which are major risk factors for heart disease. A large study published in the Journal of Clinical Psychopharmacology found that patients taking olanzapine had a 60% higher risk of developing metabolic syndrome, a dangerous cluster of conditions that includes high blood pressure, insulin resistance, and unhealthy cholesterol levels. This is a perfect storm for atherosclerosis, or the hardening of arteries, which drastically raises the risk of heart attack and stroke. Clozapine, on the other hand, has been linked to myocarditis, inflammation of the heart muscle, and cardiomyopathy, a weakening of the heart. Research published in the Lancet Psychiatry warns that patients on clozapine have an increased risk of sudden cardiac death due to its effects on heart rhythm and its potential to cause dangerous electrical disturbances in the heart. So, what can you do if you or a loved one is on one of these medications? First, it's crucial not to stop taking them abruptly, as doing so can cause severe psychiatric symptoms. Instead, discuss your concerns with a healthcare provider and explore safer options. Some newer atypical antipsychotics, like aripiprazole, Abilify, and lurasidone, Latuda, have been found to have a lower impact on metabolism and heart health. Additionally, if you must take clozapine or olanzapine, there are ways to lower the associated heart risks. Regular cardiovascular screenings, lifestyle changes like a heart-healthy diet, and exercise can help counteract some of the harmful effects. 5. Anthracyclines. Cancer is a battle no one wants to face, and anthracyclines, such as doxorubicin, adriamycin, daunorubicin, and epirubicin, are some of the most effective chemotherapy drugs available. They are widely used to treat breast cancer, leukemia, lymphoma, and other aggressive cancers. However, there's a serious downside that many people don't realize. Anthracyclines are highly toxic to the heart and can drastically increase the risk of heart attack, heart failure, and long-term heart damage. These medications work by interfering with the DNA of cancer cells, stopping them from multiplying. Unfortunately, they don't just target cancer cells. They also damage healthy cells, including those in the heart. Studies have shown that anthracyclines create a surge in oxidative stress and free radical damage in heart muscle cells, leading to inflammation, mitochondrial dysfunction, and even direct destruction of heart tissue. This damage can be immediate or slowly develop over months or even years after treatment, gradually leading to heart failure. Research published in JCC Cardio-Oncology found that up to 26% of patients treated with anthracyclines develop heart dysfunction, and the risk is dose-dependent, meaning the higher the dose, the greater the damage. Another study in the New England Journal of Medicine reported that women who received doxorubicin for breast cancer had a significantly increased risk of developing congestive heart failure later in life. So, what can be done to reduce this risk for cancer patients who need these life-saving drugs? The good news is that oncologists are aware of these risks and often limit the cumulative dose of anthracyclines to reduce toxicity. In some cases, doctors may prescribe dexrazoxane, a drug that helps protect the heart from oxidative damage during chemotherapy. 6. Pseudoephedrine, Sudafed, and phenylephrine. I just don't get it. Why should an increased risk of heart attack be among the side effects of a medication used to treat a freaking nasal congestion? It sounds ridiculous, but it's true. Pseudoephedrine, Sudafed, and phenylephrine, two of the most commonly used over-the-counter decongestants, can significantly raise blood pressure, stress the heart, and increase the risk of heart attack and stroke, especially in people with existing heart conditions. Pseudoephedrine and phenylephrine narrow blood vessels to reduce nasal swelling, but they also raise blood pressure, strain the heart, and reduce blood flow. A hypertension meta-analysis found pseudoephedrine can increase blood pressure enough to trigger heart issues in those at risk. What is even worse is that a 2023 FDA panel declared oral phenylephrine ineffective, exposing users to heart risks with no real benefit. For safer relief, try steam inhalation with eucalyptus, saline nasal spray, ginger, or turmeric tea, and staying hydrated, all effective without the cardiovascular dangers. 7. NSAIDs. While there are medications linked to a higher risk of heart attack than NSAIDs, those tend to be less commonly used, and thankfully, some of them have been outright banned. But NSAIDs like ibuprofen, Advil, Motrin, and naproxen Aleve are still widely used by millions every day for pain relief, inflammation, and fever reduction. What many don't realize is that these common painkillers have been scientifically linked to an increased risk of heart attack, stroke, and even heart failure. The risk isn't just speculation. A 2017 study published in the BMJ analyzed over 440,000 people and found that taking NSAIDs for just 1 week increased the risk of heart attack by up to 50%. The risk was highest within the first 30 days of use, especially at higher doses. The FDA even issued a black box warning stating that NSAIDs increase the risk of serious cardiovascular events, including heart attack and stroke, and that these risks can occur as early as the first few weeks of use. So how do NSAIDs harm the heart? These medications work by blocking cyclooxygenase, COX, enzymes, which reduces pain and inflammation. However, this also disrupts the delicate balance of blood vessel function. NSAIDs cause blood vessels to constrict, increase blood pressure, promote clot formation, and reduce the heart protective effects of prostaglandins, all of which can lead to a higher chance of heart attack or stroke. If you must take NSAIDs, use the lowest dose for the shortest time and avoid them if you have high blood pressure, heart disease, or a history of stroke. Stay hydrated and limit alcohol to reduce additional strain on your heart and kidneys. For safer pain relief, try turmeric, ginger, omega-3s, magnesium, or heat therapy, all effective anti-inflammatory options without the cardiovascular risks. NSAIDs may seem harmless, but frequent use can silently endanger your heart. Exploring natural alternatives can help you manage pain without the hidden dangers. Before you make any changes to your medication, always consult your healthcare provider. We're not saying to stop these medications outright. We're saying you deserve to be informed. If your doctor hasn't discussed these risks or safer alternatives with you, it's time to start that conversation and advocate for your health. If you found this video helpful, don't forget to like, share, and subscribe for more eye-opening health content. Your support helps us bring you more research-backed insights to keep you and your loved ones informed and healthy. See you in the next video.